Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for taking the time to check in. We're going to update you on what's happening with COVID, our rapid response plan, our Get Tested Week that's going on, and then also announce some very exciting programs from our economic development team to help small business owners, particularly minority-owned businesses, women-owned businesses, and other businesses in great need here in the county. So lots to cover today. I will try to move as quickly as possible so that we can all get back to enjoying what's a beautiful summer day. So overall, with COVID and with what the public health numbers and metrics look like, we continue to be in good shape. After a little bit of a resurgence over the July 4th holiday, thankfully we have seen things level back out and absolutely stabilize at a number that we're much more comfortable with, right around a 1% new infection rate. So that is very good news. Overall, in terms of where we're at since the beginning, we've now had 1,888 total positive cases since March. That is out of 43,919 tested. So that is a 4.2% cumulative rate. Again, as a reminder, at the worst of this, we were well over 20%, and now we've brought the average all the way down to 4.2. We have had 88 fatalities. That number has held relatively static, but we still, as a reminder of how deadly serious COVID is, are losing loved ones and family members and neighbors in our community to COVID. And so we have to keep that in mind as we continue to keep our guard up. In positive news, we've had 1,687 residents who have had COVID and now recovered. So that is a number that we will want to continue to see going up. Our 10-day out projections have leveled back down a little bit and are looking pretty good, which you can see there on the screen. I do want to put this graph as well up again, which is from the British Imperial College study from March of 2020. Just as a reminder that although we have been to the peak of that first curve, it is absolutely possible that if we don't continue to do the work, we could see another resurgence. And in fact, pretty much every scientific model predicts that we will see a resurgence of some kind. And I know that's not what any of us want to hear or even frankly think about, especially as we head into the fall and when we're talking about schools and we're talking about businesses. But I just want to always be straight up and let the science and the epidemiologists guide things. So I do think that is important context, that until we have a vaccine, we will have this sort of roller coaster process, and it is our responsibility as a government, but each of us as a community, to try to keep the roller coaster as uneventful and smooth as we possibly can, and that's what we're all working towards doing. In terms of our hospitalization numbers, this has remained very good. We still only have one COVID positive patient in Ulster County hospitals, and we of course send them our positive thoughts and our love and thoughts and prayers. And we have, in terms of active cases, 113 active cases. You can see on the graph that really has leveled out now. Really from end of June, we've stayed pretty steady right around 100 to 120 active cases, and that's a relatively good place to be, although of course we want it to be down to 0. In terms of the most important indicator to assess resurgence, that is what we always talk about as the new positive cases each day compared to the number of tests that we're doing. And we talked last week about our goal to both get our testing numbers up and, of course, get the number of positive cases down. So we are making some headway there. Not as much as I'd like on the testing front, but we're going to work on that. We're going to talk about that in a minute. But the numbers here look good. In the last 72 hours, we have tested just over 1,501 to be exact, just over 1,500 residents, and had 16 new positive cases. So that puts us at a new infection rate of 1.06%. That number is a number we're relatively comfortable with. Right around 1% is a pretty good place to be, that's where we want to, again, get down to 0, but we would be pretty comfortable if we could hold it around 1. In the last 24 hours, we have upped our testing, and we tested just shy of 600 folks. That's all those blue spikes on the graph represent the daily number of tested. So we want to see that go up and up and up. And we're going to continue to encourage everyone to do that. We're encouraging our county workforce, our office, and really everyone in the county to get tested as an important indicator of where we're at with COVID. That is really that first step in our rapid response plan of identification. So we're doing well there. In terms of hospital capacity, we are in very good shape, as I've been consistently reporting now for months. So if needed, we are ready there. Shifting gears to our rapid response plan, which we've now talked about for a few weeks. We are still implementing the rapid response plan. Anytime we see one of these possible clusters pop up, we immediately initiate that plan with the whole goal of containing that cluster and stopping larger spread that could turn into community spread. So good news on this front. All of the previous clusters that had presented really around starting around July 2nd, 3rd, 4th, those have all been, we've worked through all the contact tracing. They have all been contained and really isolated to a very small number of people. So that is good news. That means we detected it early. We identified those through testing, which is why testing is so important. We did the investigation process using contact tracing. We isolated those individuals using quarantines, and we know that's tough, but that's necessary. And then we've continued to communicate and enforce. So those really are those 5 components of our rapid response plan. The one possible cluster that we're still investigating is the most recently announced one, which was at the Mother Earth health food store out in the town of Ulster. So far, that has not actually even moved to an actual cluster. It's just still affecting that one employee who did test positive, but we have not completed all of the contact tracing there yet. So we're not yet able to fully say that that has been contained, but we're deep into that process. And so far, we're encouraged by the fact that it seems that that was relatively contained. So I know it's been definitely concerning and a little disheartening for me, and I think a lot of us, to hear about these clusters popping up. But what I think we need to, the way that I think about it, and I hope we all think about it, is that it's inevitable that we are going to have some of these little clusters emerge. The key is that, 1, we minimize how many by following the guidelines, but 2, when they do emerge, that we rapidly respond and contain. So I'm really proud of how we have done that, and we will continue to do that with everybody's help. So transitioning to how we do that, how do we make sure that our rapid response plan and process is working? It's really about that first step of the rapid response plan is identify. And the way that we identify COVID is, of course, through testing, primarily the diagnostic testing, which tells us whether an individual is at that time COVID positive. So in order to really boost our early detection capacity, we launched this week our Ulster County Get Tested Week. And that has been going very well so far. We've been getting lots of feedback from residents that many who weren't aware that at this point, anyone in New York State who wants to be tested is eligible to be tested. And I'll talk about this in a moment. Each of our different sites do have slightly different procedures and requirements, which I know is not ideal, but that's kind of the reality of the situation. So I'll talk in a second about how to navigate that. But what I want to make clear to everyone is myself and our health commissioner are strongly encouraging every resident to get tested, because that helps us detect any reemergence early on, especially in people who may be positive but asymptomatic, which we know is a real thing increasingly in driving many of these clusters. So how do you go about getting tested? The first step, if you have web access, the easiest way is to go to our ulstercountyny.gov page, and there's a whole section on testing, and it really talks you through all of the different testing sites, where they are, the procedures at each one. Some do require you to call ahead. Some may require you to schedule an appointment. In some cases, they may at least initially ask for an insurance card, although, to be clear, thanks to federal CARES Act, no one can be turned down to be tested for lack of financial means or insurance. So if you are having issues with that and someone is telling you that you can't be tested because you don't have insurance or you don't have the financial means, you can reach out to us. If you have any questions about testing, which I know can be a bit of an intimidating process, I urge you to, one, again, go to our website, but two, you can call our Recovery Service Center. These are trained staff from our health department and other departments who know how to talk you through all of these details and can work with you live on the phone. And the number to call there is the same number we've had really from the beginning of the crisis. It's 845-443-8888, and that is our Ulster County Recovery Service Center. And again, for questions on testing, questions on COVID, questions on economic recovery, on mental health services, on housing need, on food need, all of those urgent needs and any questions you have about them can be met and answered by the great team that we have, and I want to thank all of them working at our Recovery Service Center, which we stood up really just a few days after COVID and has been the front line of our response to make sure that you all and our community members, our residents, are taken care of. So please don't hesitate to reach out to them. I want to briefly just emphasize again that a key part of our rapid response is enforcement. Most 99% of folks at the individual level, the business level, are doing the right things. And I know they're tough, but they are necessary, and we know they work. But we do have some small number of folks who are not thinking about others and who are going about their business in a way that puts all of us, especially the most vulnerable members of our community, at risk. And I have zero tolerance for that. I know the community doesn't want or support that. So I want to make clear that enforcing those pause requirements from the state and all the reopening requirements is absolutely, has been and is a top priority for me and our whole team, which includes municipal leaders and town leaders, includes our sheriff and many others, including our health department. We receive every single complaint that comes into the pause enforcement task force, and you can see the contact information there. We receive every single one. The whole team reviews them and then follows up and acts on those complaints. You can make any of those 24/7 via phone or website. I know, and we get messages every day of frustration, and I know it's frustrating when you go to the grocery store and you're doing the right thing and you see others not. If that is happening, particularly if employees of a business are not following those guidelines, please do reach out, and we take those seriously, and we will act on those as quickly as possible. Ultimately, as I said last week, this all relies on trust, that you all and members of the community trust that we are only putting in place these limitations and these policies because they're absolutely necessary and because they work. And we trust that everyone will follow through on those. So let's please work to maintain that trust, and as you have questions or issues, let us know, and I'm confident that we can work through this, what I know is just absolutely unprecedented and kind of crazy period, but I know we can get through it, and we've gotten this far, and I know we can. Another reminder, if you do get a call from contact related to contact tracing, it will show up on your phone as New York State contact tracing. Please pick that up. That's not spam. That is information that you're going to want to know. So please pick up that number if you see that on your caller ID. All of those steps of that rapid response plan are necessary to make sure that we can keep moving forward, that we can keep reopening businesses and relaxing some of those restrictions, but we have to be responsible. We have to look at the data. We've obviously seen what's happening in other parts of the country, which is just tragic and scary. And I'm very confident that we've taken the right approach here while it's been difficult, and we've really balanced as best we can reopening, but doing it safely, thoughtfully, responsibly, as we said from the beginning. So thank you for hanging in through this. And my always request to everyone at the individual level, here's what you can ultimately do. Please remember to wear a mask. We know they work. Maintain social distancing. We know that helps significantly. And to wash hands and use hand sanitizer, especially when you're out and about. All of those things work and have been key to getting us to where we are. So those were all of the fun public health updates and all the things going on to make sure that we can keep moving forward healthily, which is not a word probably, in a healthy way and safely. I'm going to get made fun of for that one later. The other thing that I wanted to talk about today is, as we keep opening and hopefully we keep moving forward, we know that the pressure and the financial pressure and the burden on our businesses, especially our small businesses in the county, is tremendous, and it's just growing and piling up. And as I'm engaging and talking with our business owners and leaders, we hear that loud and clear. So we've been working to do everything we can as a county team to figure out how can we support our businesses in a time of need. And we've already done quite a bit, which I won't rehash, but I do want to announce two new, very important and exciting additional programs and resources we now have to help you all, and please spread the word about these. It's all part of our resilience economic plan, which has three core components, really about recovering, reopening, and realigning. And in particular, as we are still in the midst of this pandemic, we know that the need for working capital, for ultimately dollars flowing into our businesses to keep your doors open, to keep your workers employed, to help you maybe buy PPE or put up the plastic protective shields or whatever measures you need to take to open your business and do it safely. We know those needs are urgent and growing. So the first program that we're launching is a big deal. As part of New York Forward's support, we are launching what we are calling the Ulster Equity Loan Program. We know so many of our businesses have need for dollars and ultimately for working capital, but in particular, we know that historically and especially now, women-owned businesses, minority-owned businesses, businesses that are operating in low and moderate income areas and parts of our community often struggle to access these resources even in the best of times. So we're specifically setting up a $2 million loan program just to support those businesses, which we have hundreds of here in the county. The other goal here is really to try to plug some of the gaps. You know, we had the federal programs, the PPP program, the EIDL, Emergency Disaster Loan Program, but we know, and we've heard from many of you, that a lot of these often went to the businesses that always seem to get the support. And we know that has left some gaps that have actually exacerbated the inequality in our economy. And so we specifically are setting this program up, and we were able to leverage a small amount of dollars, $100,000 from our our EDA, our Economic Development Alliance, and leverage that to secure $2 million, or another, the difference between 2 million and 100,000, to loan this money out and to make that available to those businesses. So I am really excited and proud, and I want to thank our economic development team for pulling this program together. I want to thank our partners at NDC who are administering this, and of course the Ulster County Economic Development Alliance that is part of our overall team Ulster County, that have all come together to create this really innovative program. So a few more details about the program. There's a lot of words on this slide. All of this information is available on our website and in our press release that we're putting out. But just to give those folks, if you want to just do a screen capture or share this slide out, this tells you a little bit more about, it's up to $100,000. The interest rates are very low and very competitive. It's a pretty flexible set of things you can use the money for. And again, it's minority and women-owned for-profit and not-for-profit employers with less than 20 employees, and haven't already accessed federally backed programs. Again, the idea here is we want to come in and fill those gaps and ensure that there's equity in all that we're doing to support our small businesses. So if you want to learn more about this or you want to apply for this program, two ways you can do that. One, you can go to our website or to the website we're putting up here on the screen. Or, again, the central point for so many of these services and needs always comes back to our Recovery Service Center. That same number, they can also talk you through this program. It's 845-443-8888. And again, thank you to everyone that's pulled this together. I hope that, and I imagine this capital will be accessed quite quickly given the need. So if you are interested, please move quickly. And we're very excited to get this money out to support our businesses. The other thing that I want to talk about and really promote is initiative from another part of our Team Ulster County group of economic entities and assets that we have. This program was already announced by the IDA, the Industrial Development Agency, but I really just want to promote it again, and I want to thank the leadership of the IDA and the new set of the IDA board that was just recently appointed by our legislature. We talked a few months ago about the need to get everybody working together, all aligned, all rowing in the same direction to support our community in the midst of this pandemic, and that's exactly what is happening. So the IDA, another one of our aspects of our economic development team, is offering another loan program. I'm sorry, actually, these are grants. So these aren't even loans. These are just grants, which is, of course, even better. The IDA will provide up to $5,000 to organizations that are working with the IDA, or up to $2,500 for any organization, specifically for buying PPE. We know that accessing PPE or installing that protective equipment is expensive and another burden. So I really think this is a great initiative from the IDA. And within, I think, probably a month or so of the new team coming together, they rapidly rolled out this program. It will be live launched tomorrow on their Ulster County IDA website, which you can see there. And I really want to thank and give kudos to the new chair of the IDA, Jim Malcolm, and the CEO, Rose Woodworth. There's just a great energy and team dynamic among the IDA. We're all working together. We're all aligned to support all of our local businesses. So I'm really pleased and excited about that. And again, that information is available both on our county website, ulstercountyny.gov, and on the IDA website. So even as we work through the public health aspects of this, which we know we still have work, we want to continue to be here for our businesses, and please do reach out if you have any needs or challenges. We are here to work through that with you and provide those resources. finally, ending on two positive notes. Project Resilience, our countywide innovative program to meet urgent food need, is still moving along, trucking along, doing great work. We've now delivered over 266,000 meals thanks to an army of volunteers, thousands of generous donors, many restaurants that participated early on. So we're still going forward. Thank you to everyone who has been a part of that and is a part of that. And finally, as always, ending with a broader thank you and recognition and appreciation for everyone that has gotten us through this crisis so far, working on the front lines of COVID, putting yourself out there to take care of all of us. I've heard just in the last few days even so many stories of members of law enforcement, healthcare workers and doctors and nurses who have gone above and beyond, not just to help those dealing with COVID, but to help anyone in our community in a moment of need right now. We all have so much pressure, so much anxiety and worry. We don't know what's coming, but what we do know and what we can control is how we take care of each other, how we look out for each other, how we maintain our just humanity through this. And that is what has gotten us so far. That is what has made Ulster County stand out. And so let's not lose focus on that. Let's keep that spirit of togetherness and community and thinking about others as we drive forward. And I know we will do that. So thank you to everyone for tuning in. We will see you again on Thursday at 2 p.m. Thanks, Radio Kingston. Thank you, Roxanne. Thank you, Manuel. Thanks to our whole team. We will see you then. Until Thursday, be healthy and safe and resilient. And bye-bye for now.